It is now day 1 post-surgery, and it's the first day after you've had this life-changing procedure. In the morning, you will still be in the intensive care unit. Your anesthesiologist and myself as the surgeon will come and visit you together with the physiotherapists, and we will do a risk assessment to see whether you are safe to be transferred to the normal ward in the hospital. And for most patients, 90% plus, that is the case, that at this point we make a decision to transfer you to the normal ward, which is where the rest of your care will take place during your stay in the hospital. At this time, the physiotherapist would have started working on some basic exercises with you, starting the mobility journey, and also in the attempt to reduce the risks of blood clots forming, because movement actually prevents these blood clots from forming. Now, at this point, after the first 24 hours, your risk of fat embolism has really dropped down to almost zero, and if your oxygenation is at a good level, we are quite happy that you're out of most of the risk at this point, and that's why we transfer you to the normal ward. Now, in the normal ward, this is where you will be in a private section of the hospital, where you will have your own room, you will have your own bathroom, and your own, call it a mini apartment in the hospital. And essentially, this is where you will spend the next 10 to 14 days in the hospital, recovering, but more importantly, learning how to live with this new reality of having had the operation. And this means simple things like tricks of how to use the bathroom, how to use the shower, how to eat, how to clothe yourself, and all of this gets supported by our multidisciplinary team who will actually lead you on this journey on a daily basis. And it's amazing to see how quickly our patients regain their independence after this massive surgery. Now, I'm calling it massive surgery because it is ultimately surgery that involves both legs, and it has a major impact on your functioning immediately after surgery. But because people tend to recover quickly, and because we use these multidisciplinary teams, we get to a level of independence quite rapidly. And typically, during this post-operative phase, I will be seeing you at least once a day, very often twice a day, to make sure that the journey is as we expect and that it is as safe as possible. During this phase, we would also do some x-rays, which would just confirm what we've done in the operating room, and I will share those with you so that you can see what we've done. And then the magic starts happening somewhere between day 10 and day 14, where we then start the distraction of the nail. And then between days 10 and 14, we will start with the distraction of the nail, which means that we are actually starting your lengthening journey. Once we've done that and you are comfortable lengthening the nail, we can transfer you to our rehabilitation facility, which is outside of the hospital, and this is where the rest of your journey will take place.